to a place where I can easily, there we go. So there's a lot of confusion when you talk to healthcare professionals about what's the difference between population health and public health. So when you think about population health, you're talking about groups of people. So it can be a geographic population, such as a whole nation or a community, but it can also be groups like the group of people you work with, or a group of people with perhaps the same diagnoses. So you're really targeting your healthcare prevention and intervention efforts towards groups of people. Now, why this is important is if you think about policy. So people who write policy, who implement policy, who listen to us about policy, often are specific to certain kinds of situations. And so when we're addressing certain populations, it gives us the opportunity to work closely with policymakers who have interest in those areas. So it's not just looking at the outcomes, but it's looking at what determines those outcomes. So one of the things we're going to talk about today is the social determinants of health, because the social determinants of health have a huge impact on population health. And so we're going to go through those later on in this talk. So what are some of the outcomes you look for when you deal with population health? Well, certainly you're looking at advocacy. So working with the policymakers, the insurers, trying to make sure we're addressing those health disparities that often are created by gaps in social determinants of health. We're also looking at improving the health outcomes for the group. So one of the ways we can do that is by having cost-effective strategies. So if we can reduce the cost of care, reduce the cost of prevention, we have more money to actually address the issues that are occurring in the population. And then we need to become leaders for our populations. So we need to empower people within the population to be leaders, but we also need to be leaders for them and help them move forward their agendas. And then as professionals, we have the responsibility of really developing practice guidelines. So what are the best practices? Let's base them on evidence. Let's use evidence-based practice. What is it that we know that works? And what doesn't work? Because what doesn't work is just as important. But public health is something different. So public health is something we do as a society to make sure all the people can be healthy. So if you think about public health initiatives, think about things like motorcycle helmets, think about seat belts, immunizations, those kinds of initiatives that address everybody, no matter what community you're in, no matter what ethnic group, no matter what chronic illness, these things address the entire population. This is public health. So what's the difference? The difference is we're looking at wide-ranging implications in public health, something that affects everybody. Another thing, car seats for infants, not stopping smoking. So initiatives that affect everyone, the entire public, versus population health that affects a group of people. So if you think about an ethnic population that has something that's generally specific to them, think about sickle cell, think about Tay-Sachs. So it's educating those people as populations about the diseases, about the concerns, the clinical issues, and it's helping them understand prevention and treatment. Well, in 2005, the World Health Organization formed a commission on social determinants of health, and I was fortunate enough to actually be part of that, really recognizing that it's the things that we have access to that affect how we're able to make decisions. So what I describe this as is these are your chances to make good choices. So we can all we want say, you need to eat healthy, you need to exercise, tell the kids they need to play outside. But if it's not safe to go outside, if there's nowhere to walk, if they don't have the money to eat healthy because it's expensive, they can't do it. So these are the conditions you're born into. These are your chances or opportunities to make good choices. So what are some of the social determinants of health? Well, it's really looking at what resources we have to meet our daily needs. Do we have safe housing? Do we have local food markets? Access to education and jobs? What's our access to healthcare services? So I think about some of the countries I worked in where they had to walk for days to get to a clinic, to wait outside in the weather in line to get care. How do we access our healthcare services? What opportunities do we have? So sure, maybe there's jobs, but how do we get trained for them? How do we get the chance to make a choice to work in that field? And what are the community resources? What kind of support do we have in our community? Not just for living opportunities and healthcare opportunities, but leisure opportunities as well. And what are our transportation options? Is there public transportation? Does our population live near that public transportation? How do they get around? How do they get where they need to go? How safe is it? I can give an example of my daughter who lives in Cleveland, Ohio, in a probably, I would say, lower income area. She moved in as part of her church to try and, make some changes in the environment. Right outside of her house, there was a shooting and 3 people were killed. Is that safe for her to go out, go for her walk, for her kids to be outside? What does safety look like in the environment where our patients live? And what kind of social support do they have? Do they have family? Can the family get to them? Can the family support them? How isolated are people? Think about right now during COVID, where people either can't visit, won't visit, can't get there. What does that look like for our people who live alone, who maybe need help, who need assistance to go to the bathroom, to get their food, to get to their appointments? What kind of social support do they have in this era especially, but really all the time, that provides them opportunities to get the care that they need? Something we're hearing a lot about right now, discrimination and racism. It's not that it wasn't always there, it's just that we're hearing more about it now. So what are the norms and attitudes? What are people's feelings towards and support for people who might not be just like them? Exposure to crime and violence, domestic violence. Statistics have been showing that in this era of COVID, crime is going up. People have lost their jobs. They have no money. They can't access what they need. What does their environment look like? Can they walk outside? Is there trash everywhere? Is it not safe? And how about areas of concentrated poverty? Where my daughter lives, there's no grocery stores. She has to drive about a half hour to get to a grocery store. But she has a car. But what about the people who don't? How do they get what they need? And how about language and literacy? Do they understand what you're telling them? Are they able to follow directions if they don't know actually what you mean? And then how about their culture? What does their culture say to them? Do they trust you? Do they not trust you? Because if they don't trust you, they're not going to listen. So how do you gain their trust? How do you find someone they trust to make a difference? So this is a model of the social determinants of health. So if you look at the very center, we have the person who has the things they bring to the table, right? Their age, their sex, the factors that they have inherited from their family. So disease risk, so on, different gene, maybe disorders, maybe the BRCA gene for breast cancer, you just don't know. What affects that? Well, their individual lifestyle factors. But again, their lifestyle, the choices they make, could be determined by the chances that they have to make different choices. Maybe they don't have a chance. And then the social and community networks. But you can see it all comes up to those social determinants of health. And it's at the social determinant of health level that we have an opportunity to make an impact, especially towards policy. So when you look at social determinants of health and you look at all of the determinants that go around them and how they relate to diabetes, which one do you think matters? So if you start to look at them, education, research shows that people with higher levels of education have less incidence of diabetes. Health and healthcare, what's their access? Where do they live? Are they economically stable? Is their environment economically stable? They all matter. And what's really interesting about this is that we spend a lot of time looking at healthcare and talking to them about healthcare and addressing healthcare. But if you look at this, you'll see that healthcare only affects 20% of their outcome. 40% are those social determinants of health. So where are we spending our time? Social determinants of health, health behaviors, physical environment, make up 80% of their health outcomes. So we need to start thinking about addressing their care in a different way. So when you think about social and physical determinants, again, we talked a little bit about, do they have access to parks? Can the kids go outside? Can the adults go outside? Are there sidewalks? Is it safe to walk? How about education? Education is associated with a longer life expectancy. What kind of access do they have? How do we improve their health and quality of life? And do they understand things like not smoking, going for their routine checkups and screenings? Can they go? Do they have coverage for those? You know, so it's nice to think that this is happening somewhere else, right? But this is my local paper, and I live in a probably middle-class community, certainly not upper class, but people around me have resources, they have jobs. But in my own community, the headline, food insecurity plagues seniors. I would bet you 90% of the population of my community do not know this. So this is everywhere. This is widespread. It's a huge concern. It's global. And I don't know if you can see this, but it says, Buddy, have you ever eaten a healthy muffin? He said, I can't say. I wouldn't know a healthy one from a sick one. So what is it we're telling our patients, and what do they understand? We can say all day, eat healthy. So do they know what healthy means? Number one. How does that affect their cultural beliefs and their cultural norms as far as what they eat, what are their staples, and so on? And then can they afford to eat healthy? Because it's a lot cheaper to get the 4 for $4 at Wendy's, right, than it is to buy fruits and vegetables, grains, things that are healthy. But if you look at the rise in diabetes, look at these numbers. Look how it's gone up. In 1980, 108 million people worldwide with diabetes. You can see how much it went up by 2014. But look at that, in 6 years, we got another 41 million people with diabetes in the world. Very, very concerning. Certainly a pandemic. So this is a slide of this in 2017. You can see that, interesting to me, is it's the developed countries that seem to have a higher number. And so, you know, when you think about education, people with education have a longer life expectancy, developed countries having resources. How can it be that these numbers are so high? And in 2020, in the United States, 34.2 million people. So in 3 years, we went up by about 4 million. So what aren't we doing? What are people not hearing? So the rise is faster in low and middle income countries, but the numbers are so much higher in developed countries. So it's kind of a conundrum, right, as to how we address these issues across the board. Everybody needs to hear this. Everyone needs to understand the risk of diabetes, the cost of diabetes, and the healthcare outcomes. So here's the total cost. This was in 2017, so I'm absolutely certain it's gone up. And $327 billion to address diabetes. That's an enormous amount. And that's just for 1 year. Think about what we could do with that money, healthcare-wise, right? Environment-wise, social determinants-wise, if we weren't spending so much addressing diabetes as a condition in our global population. So why is it so high? Catastrophic medical expenditure. Lots and lots of complications with diabetes, especially uncontrolled diabetes. The direct cost annually, globally now, is at 827 billion, so you can see how it's gone up. And look at the losses in our in our GDP worldwide, 1.7 trillion in American dollars. So what's the mortality? Look at these number of deaths. These are people that could be working, could be contributing to our gross domestic product. It's really staggering to see that 43% of these deaths occurred under the age of 70. This is our working population. These are people contributing to our economic stability in our countries, but also for their families. So who are the contributors to their families when they're unable to work because of disability or if they've passed away from diabetes? Now, why is it increasing? Not just because of aging and growth, because of our trends towards obesity, unhealthy diets, and sedentary lifestyles. In our local paper today, there was an article about how people who are working from home aren't getting any physical exercise. So I have to say, for me, this is my home office that you see because our university is working from home. I have been since March. I come in and I sit down here early in the morning and I sit here all day, right? It doesn't occur to me to get up and walk around, where when I was in the office, I'd walk down the hall, I'd walk and see people, I'd walk to get my lunch. My steps have decreased significantly. And we know obesity is an epidemic, unhealthy diets. Again, you got to look at resources, but look at the deaths every year. 1 in 20 deaths is attributed to diabetes. That's a diabetes death, 6 deaths every minute. So what's the World Health Organization doing about that? Well, they really have 4 areas that they're addressing: prevention, management, access to medication, and surveillance. So again, prevention, looking at childhood obesity, looking at our policies, legislation. What kind of approaches do we have? But managing it, and here's where we come in as providers. Clinical guidelines. Do we understand them? Do we contribute to them? Can we make an impact in those clinical guidelines? Updating the criteria to diagnose it, getting registries so people can be reached with new programs, and then having access to care. And then surveillance. Let's make sure we understand the problem. You know, for every person we know about, there may be one we don't know about. These numbers could be much higher. So how do we address this? How do we get the surveillance to understand? So one of the things the World Health Organization did is they pulled together the World Non-Communicable Disease Congress. So these are non-communicable diseases like heart attack, like obesity, like diabetes, right? Like trauma, those kinds of things that are not communicable. So not HIV, not measles, not mumps, not polio. These are non-communicable diseases. So when you look at them, they're really driven by 3 things: the economics, the health systems, and the people. And if you look at the outcomes, and you can see them here, you know, it costs us a lot to address these non-communicable diseases. Then people can't work. Many of them die, leaving their families in poverty. They have increased disabilities, their incomes decrease. So non-communicable diseases across the board have an enormous impact on the health outcomes of our world. So if you look at these numbers, the trends in the deaths up to 2015, and these have not been updated, so they may seem old, but if you know how things are reported, you know there's always a lag. But if you look at the countries and the deaths from non-communicable diseases, you can see the numbers of deaths. It's really frightening that this continues to happen, especially when this is something that where we can have an impact. So what does this mean for diabetes? Well, it means that in 2011, the UN did a declaration on non-communicable diseases. And then the outcome of that was a global action plan. And their target was to halt the rise in diabetes. And the secondary target was a 1/3 reduction in premature mortality. So what they did, and this is an outcome of the group that we worked on, it's a package of non-essential or essential non-communicable disease interventions. It's called the PEN interventions. This is free. It's on WHO's website. It is voluminous, but you can download it. You don't have to print it. And so what their plan is to develop or strengthen preventive, promotive, and curative programs to address non-communicable diseases. So if you look at them, there's conditions, cardiovascular we talked about, cancer, diabetes, and so on. But there's also their risk factors: alcohol consumption, tobacco, unhealthy diets, and lack of physical activity, all of which can contribute to diabetes. So they have a framework to implement it. I know you probably can't see it on this slide, and I have to say I hate people who say you probably can't see this slide, but I hope this is an impetus for you to go in and look at those PEN interventions and look at this so it really looks at what are the gaps, what do the social determinants of health mean towards addressing these gaps in these PEN interventions. And specifically for type 2 diabetes, it talks about multisectoral approaches. So we just can't do it from one area, right? We've got to engage everybody in this campaign to prevent type 2 diabetes. We have to look at fiscal policies, at legislation. How do we change the environment, and how do we make people aware of their health risks? And by doing that, we can promote healthier diets. We can promote physical activity. We need to think about that. So what are opportunities for us to have interventions? Well, if you think about the lifespan, there's kind of 3 areas where we can intervene. Infancy, you know, we've talked about it a lot over the years, but breastfeeding for 6 months. Nutritionally adequate and safe complementary feedings. How do we make sure that they have that they're not watering down formula, right, to make it last longer, that they have safe food that they're providing to these infants. And then childhood and adolescence, this is the perfect time for us to start talking to these kids about exercise, about eating, about what's healthy, about what's not. And if you go back to that cartoon, I don't know if the muffin I ate was healthy or not, right? So how do they figure that out? And how do we start having little cooking classes for them? Grocery list classes for them, a field trip to a grocery store to show them to shop the perimeter, right? Not shop the middle. Restrict access to some of the foods. One thing I've noticed on our television, I have young grandchildren who watch the Saturday morning cartoons. There are less and less advertisements of high-sugared cereals. I was really happy to see that. And then what are our tobacco and alcohol controls? What about vaping? What does it mean? What does the research show? Do the kids know that? How do we educate them? And you know, this is their era of nothing can hurt me. So you can show them all the black lungs you want, all the jaw cancer you can, and they say it's not going to happen to them. So how do we make an impact to this population? And then in adulthood, again, smoking on the rise. How do we implement tobacco prevention and cessation programs? How do we make sure people have access to food? And again, this would be a really important place to have cooking classes, to give grocery lists, to take the church group to the grocery store, start that education that perhaps they didn't get as an adolescent, and help them see how they can prevent what's healthy to eat. So the global report on diabetes comes out every few years from WHO. Again, it's something I would recommend that you take a look at. But here you see kids playing outside. You can see the trash around them. You can see the limited area that they have. How is that affecting our population? How do we create those safe spaces? How do we clean up the trash? How do we help people respect their environment? So here's what is important to know. It can be delayed or prevented in people who are overweight. Diet and exercise are what's most important. So don't reach for, excuse me, for the medication, right? Reach for the education, diet and exercise. High-risk approach needs to be implemented. Look at what resources are available. Address those resources. Help people have the good chances to make the good choices. Part of the initiative is called Step Up, use the stairs. So if you think about healthy workplaces, and I don't know in all your environments how many people are still going into work or working from home, but use the stairs, right? Park further from the entrance to the building you're going in. Walk to the store if you can. Now, again, you need to think about, so for us, my opportunity to walk, I can make decisions, right? I can walk to the store, I can drive to the store. There are a lot of people that are already walking plenty because they don't have a car, they don't have public transportation, they don't have the resources. So again, you have to make an educated decision about how do you talk to someone about exercise and what's available to them and what makes sense. Have that school-based approach. So encourage physical education in schools. Now, it's really interesting because in our local school system, my son teaches physical education. And they came across about 3 years ago and they were in a budget crunch and they said, we're going to cut physical education out of the schools. For some of these kids, this is the only activity that they get, is the activity they get in their gym class in school. Now, we were fortunate enough that that didn't happen. And there was a recognition that this is really an important part of keeping the children healthy. But it's interesting that people's heads go there, right? Well, let's cut that program. The kids can run around at home, but maybe they can't. Maybe they can't. And then think about our role in managing. Look at those Penn interventions. Excellent information there on prevention, not just prevention, but also treatment guidelines. Looking at a small set of generic medications, things that people can afford or have access to. Again, diet and physical activity. I just can't say enough about the importance of those two things in addressing the risk of diabetes, prevention of diabetes, but also as management of diabetes. Patient education about self-care. Can diabetes be reversed? Type 2? I have heard people who manage it well, lose weight, get physical activity, coming off their medication because they no longer have the numbers that indicate they're even pre-diabetic. And then regular screening and looking at treatment of complications. So you would think that people might recognize complications in themselves and maybe go to the doctor. But we have a neighbor who actually right now is very, very sick with COVID, who over time I kept noticing, I thought he looked terrible, right? And his complexion was changing. He had gained an enormous amount of weight. A lot of it looked like water. He would go golfing with my husband and say, I didn't see where my ball went. So clearly his vision was affected. This is an educated man with a good job who never went to the doctor. And when he finally was very ill, found out he was diabetic. So these aren't just people who don't understand and aren't educated. This is a wide range of people across the world in our populations who don't pay attention to what's happening with their health and don't understand some of the symptoms, some of the issues, and then what those outcomes could be and how dangerous it could be for them. So we have the responsibility to screen, to let them know what the risk factors are, to recognize, to ask the right questions, and to intervene when appropriate. So who has access to affordable insulin? Isn't it interesting that low-income countries pay more for insulin, while high and middle-income countries pay the least? 23% of low-income countries say insulin is generally available. What's happening? How can that be true? Who can afford it? Do they have refrigeration? How do they get it? Do they understand how to take it? Can they have clean needles? What does this look like? We need to pay attention to what is access to affordable insulin. And then early detection, treatment of complications. Think about the things that occur with diabetes that are devastating, debilitating, and actually lead to mortality. End-stage renal disease, what does that look like? How do we screen for it? Cardiovascular disease, are we asking the right questions? Blindness, the eye exams, amputations. Are we educating our patients in a way that they understand what the complications could be, maybe what complications they're suffering from, how to prevent them, and why, if they don't have diabetes, but if they are pre-diabetic, why they want to intervene now, manage those risk factors, and not become diabetic. We need integrated management of diabetes with other chronic healthcare conditions. So diabetes usually doesn't stand alone, right? It's usually related to other things like obesity, like sedentary lifestyle. How do we integrate the care so that we're looking at the big picture, what all the risk factors are? How do we look at prevention? How do we look at promotion and care? And then how do we look at people with other diseases? In some settings, people with TB have diabetes that goes unnoticed because we're treating the TB. Same with HIV. So think about what other things are associated with diabetes and how we address those globally and how we make sure that we're treating those and examining those. Every country needs a national plan to prevent and control diabetes. So if you look at these numbers, many countries, if you see, have a national diabetes plan, but not as many are funded or operational. So it's great to have a plan. It's important to have a plan, but if you don't follow it, and if it's not funded, then you don't have a plan. 68%, I thought this was actually pretty high, have policies for diet and physical activity, but less than 50% of them have really looked at a population-based survey of blood glucose. What are we missing? Who are we missing? What side effects are they suffering from? What's progressing and them leading to early disability, debility, and mortality? So again, we're looking at 177 countries. Only a third have the three basic technologies for blood glucose, urine strips, and height and weight. So blood glucose is generally available in about 50% of lower income countries. Think about the number of people, again, that we're missing. Think about how inexpensive it is to run blood glucose. How do we change that? If this is our country, how do we address it? How do we look at those complications and discuss them and think about our policymakers and get the money for these essential treatments? So what are some recommendations? Certainly having a multisectoral commission to really address all the areas that are affecting these chronic illnesses, not just diabetes, but across the board. How do we address these? What kind of leadership do we need? Who do we need to engage? So you need to engage patients, right? People at risk, people who are already diagnosed, families, policymakers, legislators. How do we pull them all together and have them help us develop policies? I mean, how many times has someone given you a policy and you think in your head, well, that's never going to work? Because nobody asked the people who have to implement it. So let's involve the people who it affects. Let's look at our leaders, look at our health ministries. What do they understand? What are they addressing? What kind of resources do they have or could they shift to address these problems? And then let's really look at overweight and obesity. Just certainly a pandemic around the world. We need to strengthen our healthcare systems, our primary healthcare especially. What are our protocols for getting people seen, treated, and screened? What kind of research are we doing? So do we understand what's really happening in our country and how we can make an impact on that? And then how do we collect that data and how do we use it? So how do we understand the use of data? You know, people say you can make data say anything you want it to say, right? You can put any spin on it you want. But how do we really look at that data and start making a difference in outcomes in our population?